Thank you, Sarah. As we've continued to report, rural ambulance services in Minnesota continue to struggle with funding, which is why the state has opened up applications this month for $24 million in grant funding. The money is intended to boost positive health outcomes in communities like Lewiston. KIMT News 3's Evan Berg spoke with the city's ambulance service about why more help is needed in small towns across southeast Minnesota.
The state of Minnesota has approved $24 million in rural EMS aid. I talked with the Lewiston ambulance service to see how that money could help improve things for rural, volunteer, and hybrid services.
It's not a fix all. It's not doesn't solve our problems that we have in rural EMS. It definitely is a Band-Aid or a tourniquet, is what we would say.
Matt Essig with Lewiston Ambulance Service says many rural ambulance services are running at a loss, relying on saving $500,000 a year from volunteer services.
Even here in the city of Lewiston, our neighbors in St. Charles, taxpayers are help funding the service. We just don't have the volume, and the reimbursement from insurance doesn't make up what the actual true cost is to run a rural ambulance service.
Essig says grants like these provide funds to help bridge those gaps, allowing services to replace $300,000 ambulances, refurbish facilities, and replace other equipment as it gets old.
Yeah, this funding can help with that. It could help, with some staffing, different staffing models, maybe to ease the burden and not go into it all at one time. But definitely isn't going to fix all of our problems.
He says there is also a shortage of volunteers, which can stretch a lot of rural ambulances thin when they're the only source of immediate health care within miles of their small community.
We just need to keep being creative. We need to keep looking at the model of care we provide, how we can potentially do it different to save, people money, but still provide that very high standard.
Essig says if Lewiston is lucky enough to receive one of these grants, the money would mostly go towards equipment upgrades and towards expanding their garage so that their conference room has a few less ambulances in it. In Lewiston, Evan Berg, KIMT News 3.
EMS services interested in applying for grant funding must do so by September 16th. The Minnesota Department of Revenue will then decide how much money each department receives based on need. Money will be distributed by December 26.